It's crowded, it's controversial, but most importantly for its patients, the Family Health Clinic in Hamilton is free. And this is what's attracting registered patients by the hundreds.
I think at present it's about 6,900 enrolled patients. That means patients who belong to us. But we have got registered casual patients also, about 12,000 plus now.
Dr. Suresh Vatsyayann started the free service after setting up the Health for All Trust 3 years ago. He says it was a huge risk for a passion to help the poor that's worked out quite well.
Almost 40% of the public cannot actually afford to go to a doctor. Certainly not twice in a week or 10 days, and certainly not with 5 kids. It's almost impossible.
Many patients who've switched over for the free service say the family clinic has made a difference to their lives.
For us to go to the doctor, it's $40, $50 somewhere else, and we don't have that week to week if you're on a benefit.
Like taking history, doing examination, and we consult him for the treatment part, and he tells a lot many things, and we learn a lot over here.
If we get about $9 or $10 a patient a month, that's good. You just imagine a patient, the poorer of the poor patients come at least 30 times a year. Every week they are running because they have 5 children. One gets sick, then another gets sick, then another gets sick, and they keep on coming to you. And you divide it by those 20, 30, or let's say even 12 visits, $9 a month. That means not even $1 a month. I don't think that's enough for any practice to run. By having sheer number of people, those who come to us, we have managed in a way that our subsidy is more than enough to look after us. And the extra services like surgeries which I perform and donations from people look after us well.
Questions posed to the Health Ministry about the clinic's subsidies and operations still remain unanswered. The only comment the Medical Council made was that there's nothing wrong with the kind of service provided here. In the past, some in the medical fraternity have questioned the clinic's operations. Dr. Vatsyayann doesn't want to talk about this, but some of his patients do.
Because they are being threatened by a doctor who's coming in and doing it on a low-cost basis. He's putting the time in, he's working long hours, admittedly, and I think he's doing very well. But you see, a lot of the other doctors, they might start at 9 o'clock and they finish at 5. And I'll tell you what, they charge like scalded cats, and they don't offer the service.
You have 2 assistants here as well?
2 more assistants who sit here, yes.
And it's always full?
Always full. So 4 people are seen at a time. And then I move from one room to another room to see patients.
To check on your assistants?
Yeah, and then see the patient, make final diagnosis, give treatment.
And how many patients a day?
About 100, 120 patients a day.
Every day?
Every day.
Dr. Vatsyayann insists he works hard not for the money, but to provide a much-needed service.
I do a job, I do a work job 24/7. I do so many surgeries. I put in so much effort. And I think every doctor should be paid accordingly.
No place I'd rather be.
$150Ks there, 150Ks back. Hamilton to Tomaruenui, Tomaruenui to Hamilton. Dr. Suresh Vatsyayann drives it every weekend. It was all meant to help out a desperate community. Now it's turned into a bitter fight.
It's not my fight, it's not a Maori fight, or it's not a Paka fight. It's fight against the forces which try to hold the public to ransom.
If you got sick in Tomaruenui at the beginning of this year, you couldn't do what many of us just take for granted. Rush off to the doctor. Back then, there were only 2 GPs in town, serving a population of up to 10,000. Some people waited several weeks for an appointment. Some went out of town to Turangi or Te Kuiti. Others stayed at home, getting sicker and sicker.
I'll give you one example. A lady comes with 5 kids. All of them, 100% of them, all of them pass from the ears, both ears. Not been seen by a doctor for the last 6 months or more. And to me, those ears are stuffed forever. Somebody talks about rural funding. Where does that funding go? I just cry, and it's so sad. And that's the situation here generally.
And that situation is why the Tomaruenui Kokiri Trust was set up. Established in 1996, it's been running community and counselling services for the town's Māori and poor. But the grand plan always included hiring a doctor. Little could the trust know that its doctor would come from about as far away from Tomaruenui as you can possibly get. This is Suresh Vatsyayann, his home province, the Himalayas in India. He always wanted to be a doctor.
I think that's my life. If I was not a doctor, I wouldn't survive. It's wonderful. It's so heartening. It's beautiful.
After 25 years in India, Suresh moved to the Cook Islands to work for the United Nations. While there, he discovered New Zealand. With his compassionate zeal, it was almost as if he was destined to end up in Tomaruenui. Spend just a few minutes with this man, you can't help but sense his passion. Bollywood film music on State Highway 4. But for the last 7 months, every Thursday night, Dr. Suresh Vatsyayann, or just Dr. Suresh to the locals, has locked up his Hamilton practice and headed south. A weekly pilgrimage that started after a chance meeting with the Kokiri Trust CEO. But there's another difference. In any other practice, the care of many of these patients would be subsidised by the government. But here at the Kokiri Trust Clinic, they aren't. The Health Board has refused to hand over a cent. Without those subsidies, the Trust has to pick up the tab, and the doctors ended up working for free. It started with the best of intentions, bringing desperately needed healthcare to the sick of Tomaruenui. But it quickly descended into a lengthy bureaucratic scrap. Both sides were adamant that they were in the right. Then came the allegations: suppression, oppression, discrimination. For Dr. Suresh and the Kokiri Trust at least, there was no other option except to take radical action.
Dr. Suresh Vatsyayann and 2 of his nurses stopped eating last week and protested not being paid government subsidies.
Such radical and unprecedented action caught the nation's attention, making news around the country. This is the moment 3 weeks ago that Dr. Suresh began his protest.
I'm going on hunger strike from tomorrow morning. And hunger strike till death, though. I'm not going to tell everyone hunger strike till death. I'm saying hunger strike indefinite.
Either you fight or you suffer and fight. And that's what we are doing. We had to find out a way out that we could continue serving the public, at the same time let the public be aware of what's happening.
And he wasn't to be alone. Practice nurse Nada Fenton.
Like some people say, I open my mouth before I think. I said, well, I'll join you.
Why have they not?
And Rakahawai Walker.
I would think that when they're boasting about closing the gaps of inequality, this is where it happens. Come and see us. Sit in our waiting room and see it happen, and then tell us that we don't deserve funding.
This is gone now.
With both sides not budging, the hunger strike went on.
It'll lose. But it's good for the heart, eh?
For the first week, Dr. Suresh and his 2 nurses refused all food, and the weight dropped off.
74.6 minus 66.2 would be about 8.4 kilos.
8.4 kilos in a week.
Yeah.
I would never have been able to do this just, you know, for a diet or something. It's something that really, I'm really passionate about.
Everyone knew by now there was not going to be a quick resolution. It was going to be a long, demanding battle, both physically and mentally.
This is not because that I'm brown or black. It is not because I'm an Indian. It is because what I am. Any injustice done to anyone else in your presence, and if you are not trying to stop it, you are as bad a culprit as the person who is doing injustice. Who's that? Who's there? Funky boy, eh?
An extraordinary measure to fight a funding battle in rural New Zealand. Behaviour perhaps more suited to political prisoners in Ireland, or Mahatma Gandhi's struggle for the independence of India.
Tell me another way out, and I'll do that.
How long can you do this? What's it going to take to make you eat?
Once they apologize to the public, once they accept their responsibility, accountability, we are off.
But as of tonight, there is still no resolution. All the might of the law, the fine print of Section 88, head to head with a small Maori community trust and its unorthodox, resolute doctor, Dr. Suresh Vatsyayann.
We don't have time for negotiations. We have time only for people, people and people.